See, it's kind of interesting. The way I practice medicine is I always like to I always like to pretend there's a blood supply shortage because I prefer, I look at blood as a precious commodity that should not be used just because. And, and there is morbidity to chronic blood transfusions. Iron overload, and, is one of the major concerns. So it does, as a hematologist, I'm very happy to be able to reduce the amount of transfusions to my patients, and use of Voxelotor has allowed me to do that, which in this time of, I feel like the Omega Man practicing medicine, and as I drive to work in an empty town, it really has helped quite a bit, and as things, at least in my own practice, in my own area here, things are starting to normalize and to some degree in terms of at least volume of clinic and volume of patients, and it has been very, very helpful to be, to be able to not have as many transfusions as it did in the past in my clinic. And it's great for the patients, of course, most importantly.
Yeah. Yeah, but again, I think there is something to the fact that it is beneficial for physicians as well. I think that's the mark
Absolutely,
of
yeah.
therapy, right?
Yeah, so in this time of a blood supply being more precious than usual because of so many terribly ill patients with COVID, uh, it gives you one more option of being able to avoid transfusions in this one population of patients. I would never suggest using it for somebody who has had a stroke, who's on chronic transfusions, but in a patient who runs a low hemoglobin and is getting transfusions because of a lacking response to hydroxyurea or less than good, or an inability to take hydroxyurea for whatever reason, this is a great alternative.